Well, let's get the reaction to all of that from our London correspondent, Bénédicte Paviot now. So, Bénédicte, a pretty ugly row going on between Brussels and AstraZeneca. What do people in the UK make of all of this?
Well, the British government is refusing to comment today on any contractual agreements between the UK and the firm of AstraZeneca, or whether they may conflict with the company's agreement with the European Union. A spokesman for the government said this morning that the UK, quote, remain confident in our supply of vaccines and that it was committed, I'm still quoting, to its vaccine rollout plan. Now, the UK Minister Michael Gove said on Wednesday that UK supplies would not be interrupted. The Health Secretary, Matt Hancock, also said that he hoped and thought that some solution could be found to help what Boris Johnson was earlier calling in Parliament on Wednesday our EU friends. Of course, the row has been growing, the tension has been mounting, and I think that's why it's very clear that the British government does not want to get involved. But if there is a certain pride in the massive, very successful, historically big vaccine rollout, where almost 7.5 million people have received the first dose of an anti-COVID vaccine, there is, of course, triumphalism from certain quarters, like, to be expected, tabloids like The Sun, which puts the latest possible fourth authorised to be soon vaccine, Novavax, on a British flag on its front page. So I think the British government being very cautious here, not wanting to heighten tensions or step into this contractual row.
And there is such a mixed picture, isn't there, Bénédicte, in the UK this week? The death toll topped 100,000, but there is also a lot of good news coming out on vaccines.
Yes, you're right. A complete paradox where we started the week with this extraordinarily grim record. The UK has the record for being the worst in Europe, the fifth worst in the world, because it topped 100,000 deaths due to the pandemic, which is almost now a year old. And that 100K, of course, is extraordinarily worrying for its population, whether it's in England, where we have a national confinement for the third time in a year, and also very strict measures in the rest of the UK's nations of Scotland, Northern Ireland and Wales. But of course, the paradox is that after being the first in the world to authorise the Pfizer-BioNTech vaccine 2 or 3 weeks before the EU did, after starting clearly, as I referred to, its very successful vaccine rollout, the biggest in its history, where, as I said, 7.5 million plus people have at least received the first dose, because the policy here is get a first dose in the arm of people and delay that second dose. This new Novavax American vaccine that would be made here in the UK, which, according to clinical trials, and that's phase 3 clinical trials, would be over 89% effective in these large UK trials. So if that is authorised, and that would happen in the next month or so, it would be rolled out, we think, 60 million doses in the second half of the year. So from that point of view, something certainly to be very proud of and which is very successful.
Bénédicte, thanks very much. Bénédicte Paviot there reporting from London.